All right, next we're going to do Chapter 2 of Medical Apartheid by Harriet A. Washington. Chapter 2 is titled Profitable Wonders. Again, I'm just going to do just little snippets of these. If you want more detail, please, read the book on your own. I'm just going to start by reading this. Many slave owners, such as Dr. Hamilton, Dr. Marion Sims, Dr. Nathaniel Bozeman, and Dr. Stilwell, were themselves physicians who bought and raised slaves for the express purpose of using them for experimentation, period. So we have doctors, or healers and teachers doing unethical experiment on slaves just because African Americans were considered inferior. Something that's incredibly important today is informed consent, and there's a whole thing called the HIPAA law and violation and policies and all these things. Informed consent basically just means that somebody knows what they're getting themselves into. They know the pros and cons, and they agree to move forward with it. Now, sometimes things were said, a lot of times they weren't said. Even if they were told to the patient, the experimental subject, they didn't have any legal course if something were to go wrong, because there certainly were white subjects that were experimented on as well too. So for Chapter 2, again titled Profitable Wonders, I'm going to focus on Dr. Sims, who was celebrated as, quote, father of American gynecology. There was a quote here from another doctor who said that when the history of modern gynecology is written, the work that another doctor did will be represented as the dawn. And the first bright planet that appeared in the dim light of dawn was Dr. Sims. So this doctor did a lot of forceful experiments on women. One of his main things was that he was perfecting the vesicovaginal fistula operation. And he said he perfected this by May of 1849 after scores of operations over 5 years. A lot of these, in fact, 30 operations, were done on just one patient alone. Sims' paper on these operations was published in the American Journal of Medical Sciences. To be able to accomplish his surgeries, he had to have women held down or sometimes drugged. Initially, he had several male doctors hold some of the patients down, but after a while, they couldn't take it anymore. He'd have women undress completely, then kneel on hands and knees while he had several physicians took turns inserting a special speculum so they could see inside the vagina. He said, "I saw everything as no man had ever seen before." And in fact, many physicians flocked to his, it says, shack to see what no man had seen before. So did prominent citizens and local apprentices as well. During this time period, some of the things that could have been used, one was ether, but apparently he would refuse to use this. However, he sometimes gave this to white women when they were having vaginismus, making basically sex impossible. He would give that to white women so that their husbands could have sex with them while they were unconscious. So I guess you could say that not only did he treat black women in a terrible way, he also did that to white women. And this is, of course, supposed to be our healer and teacher, a doctor. The rest of this chapter goes on to talk about a couple other things, but also mentions just the ethics and the question of whether or not we can apply today's ethics to the ethics back then. I'm not even going to get into that. It's horrible. Horrible things happen. We know that. What I'm really focusing on here is how this is affecting us today. And like I said in the previous chapter we went over, how this affects me even as a medical student when I wasn't trusted. All right, so I hope you guys like this. Next, I'm going to go over Chapter 3. Please give this a follow. Please subscribe. Please share this. Check out the TikTok and Instagram for some shorter versions of this. And next, we'll do Chapter 3. Thanks.